All right, let's take a look. Let's see. Let's see if everything sounds correct. And if it does, we'll get going, okay? Just give me a second. So sorry for the delay. Let's take a look here. See what we sound like. Okay. Just going to double check one more thing, just to make sure we're on the same page, on the correct page, let's say. And if everything's good, we'll keep going. I think so. Okay, let's just share this on Yield Twitter, and then once we do that, we will get going. Okay, let's take a look. All right, just one more second. So very sorry. Here we go. Copy link. I'm going to go over here and share it. Okay. All right, so we are shared. And because we are shared and things are up and running, that means it's time to get going. Okay, well, good afternoon, good evening, whoever you are, wherever you are. My name is Dr. Patrick Lockwood, and this is yet another episode of the podcast called UnShrink Me. And for those of you who are brand new, UnShrink Me is a podcast that is specifically focused on, dedicated to explaining and understanding concepts and ideas in mental health. So the purpose of this podcast is expository and critical. My goal, genuinely speaking, is to help everybody in therapy land, the world's worst theme park, understand what they're doing and hopefully helping them get more out of their therapist, their psychiatrist, their counselor, etc., etc. So the spirit of this podcast is more for the consumer than it is for the professionals, although we have some professionals who come out to chat from time to time. And so I look forward to seeing them here today, hopefully in the chat. But, again, the spirit of this podcast is, can we have an accurate and thoughtful discussion about what works and what does not work in the treatment of or management of mental health issues? So that's the spirit of this podcast. This is not formal clinical advice, so do not sue me. I am not acting as Dr. Patrick Lockwood, licensed psychologist in this podcast. I am simply just Patrick, who has experience as a professor, as a clinician, as a consultant, as a supervisor, in many different roles, that I'm trying to marshal those experiences to critique ideas that are popularly or commonly discussed about this. Yo, it looks like Jonathan Cogburn is here. So happy that you are here. Happy Saturday, Jonathan. Glad you're here. Thanks for being here. Really appreciate it. So today we got a good one. We got a doozy of a podcast today because we got to talk about some contentious things, some things that are scandalous and potentially socially problematic that might even get me canceled. We'll see. But today's podcast, we're going to talk about narcissism. We're going to talk about ethics. We're going to talk about who has power in what ways. And we're also, importantly, going to talk, I think, at length about, how do we actually know we're being helpful? So for people who are seeking out therapy, for people who are seeking out counseling or treatment or rehab or whatever it is, we're going to talk about what we think actually helps and why we think it helps. Hello, Megan. Glad you're here. Good evening. Glad you're here. Willow, if you can see in the corner there, is here, and she is going to, I don't know what she's going to do, but she's going to probably just look cute, is my guess. So welcome, Willow, to the podcast as well. So let's start out with a softball, but before we do, as always, this podcast is not N-O-T, sponsored by Celsius. However, it's great. It fuels this podcast. I love it. It's probably killing me, but whatever. So, love it, love it, love it. Let's start with the first topic du jour. As always, I like to start with a couple of tweets that are more softball topics, and then once we move through the softball topics, we'll move into the deeper stuff. So, kind of on the simpler side of things, I would just like to bring up one of my interesting colleagues on Twitter. Her handle is at NoBSTherapist, which is at TweetATherapist is her Twitter handle. So her name is No BS Therapist. On January 21st, about a week ago, she put this post out, and I think it's really worth discussing. So let me retweet it real quick, and then we'll hop on the actual exposition piece of this. Just one sec. Okay. So, at Tweet a Therapist on January 21st said, and I quote, judgment, you fucked up, so you're out. Control, you fucked up, now you owe me. Resentment, you fucked up, I won't forget it. Boundary, you fucked up, here's what I need going forward. Clarity, you keep fucking up, I see patterns now. Grace, you fucked up, but owned it, thanks. So this is an interesting little tweet of hers. It's kind of a definitional post, basically. She's defining what all these things are from her perspective. And one thing that I think is really important, we lost Willow. It's all right. So one thing I think is important is the way that she crafted these definitions. So she's crafting these definitions from the person who's been hurt, basically. And so what's important about this is, hey, Phil, good to see you here. It's not really taking into account the other person, their intentions, their motivations. And the reason this might matter in therapy land, again, the world's worst theme park. Excuse me. What's good about this is it acknowledges that people experience injury. People experience where, the other world, the other person, the world in general harms us, because it's true. People do things that violate our boundaries and our principles all the time. Now, what I take issue with is the idea that mistakes, specifically, like you fucked up is the phrasing she uses, always are consequential and meaningful to discuss. So something that I would like to put out there, and I don't know that everyone will agree with me, but maybe those of you in the chat here can share your 2 cents or even 3 cents. Like, what precisely matters when people make mistakes? Like, should we take all these things seriously or personally? So for instance, when the phrase you fucked up is uttered, what does that mean? Is that maximally fucked up or like minimally fucked up? Because certain little mistakes, like, who cares, right? Why would I care about them or even bring them up in therapy? So I think one conversation that could be started by this tweet of the No BS therapist is, how much should it matter when people fuck up and why? Right? And what are the boundaries and why do they matter to you? Because people make mistakes all the time, and taking them personally or making them even meaningful could be a sign of mental ill health, for instance, or it could be a sign of just crappy boundaries with yourself and other people, or it could just be a sign that no one taught you how to not attach to people and their behaviors, because, for the most part, people's behaviors have nothing to do with you, because most people aren't even like unselfishly thinking about you. Most people are just kind of lost in their own heads. So just want to put it out there that I think it's a great post because we're giving some practical definitions of the ways in which judgment, control, resentment, boundary issues, clarity, and grace work. What's missing is the fact that it's always about the way the world injured me, and I don't think that that's always true, because what's missing is maybe you did something that caused their reaction, right? So like, if they fucked up, but you were the one who instigated it, perhaps that you have some responsibility in that. So just some thoughts. It's just a nice softball tweet to get us going. Now let's talk narcissism. So there is this, I think, Instagram famous person who also has a pretty big following on Twitter. So I don't know if I have this correct, but we'll see if I do. So let me retweet this real quick, and I'll explain who this person is and why it matters and how it's a problem, I think. Okay. Okie dokie. So there's this person on Twitter, and I believe on Instagram as well, named Dr. Nicole LaPera. Her handle on Twitter, if you follow her at all, is at The Holistic Psych, PSYC. For those of you who don't know mine, my handle on Twitter is at Alobha Patrick, ALOBH, ABATRICK. Anyways, so she said about 4 days ago this on Twitter. Now, it's a lengthy set of posts. I'm not going to read them all, but I'm going to try and give you a fair summary. And if anyone thinks I'm not giving her a fair summary, please tell me, shout at me, let me know, because I don't want to be accused of misrepresenting or paraphrasing in a way that's self-serving. So here's what she said. Dating people with narcissistic tendencies is one of the leading causes, is what she should have said, cause of almost every health issue we see. Few people connect health issues to relationships, but the connection here is research-based. So Jonathan said, before I get to Nicole's Dr. LaPera's tweet, Jonathan said, on the last topic from Virginia Satir, the feelings of worth can only flourish in an atmosphere where individual differences are appreciated, mistakes are tolerated, communication is open, and rules are flexible. Yeah. So to go back to No BS Therapist tweet and talk about this. So Satir was a family systems therapist. And the great thing about this quote of yours, Jonathan, which I hope everyone sees at some point, is it's this idea of atmosphere. It's a metaphorical word she's using, but she's correct about it, which is atmosphere is multiple things. It's air, it's dust, it's water, it's clouds, but it's also the relief against which the atmosphere is painted, which is the ground and the earth. And so, humans operate in ecosystems, right? We are ecosystems, essentially. And so our minds are ecosystems. So we have to understand our individual differences, and we have to appreciate how different we actually are. And you fucked up is very subjective. Because some people are offended by things that make no sense to me. And some people are not offended by things that don't make sense to me as well. And so it's rather subjective based upon your culture, your temperament, your personality, things like that. So we should talk about mistakes because mistakes are always going to happen. Something I would like to point out that I think, one of the reasons why I liked No BS Therapist tweet is mistakes are always going to happen. People are always going to make mistakes. So it's not a question of if someone will make a mistake with you in an important relationship. It's a question of when. And then the question is, what are we doing with that mistake? Are we talking about it? Are we being quiet and resentful? Not very useful. Are we having grace? Mostly useful, right? What are we doing? The rules are flexible, right? That's exactly right. So thank you for posting that, Jonathan. Satir's great, And for those of you who don't know, family systems therapy, hidden gem in the clinical psych world. So let's go back to Dr. LaPera, shall we? So Dr. Nicole LaPera said 4 days ago, dating people with narcissistic tendencies is one of the leading causes, she missed the S, of almost every health issue we see. So first and foremost, she said this was a research-based claim, and it's not. It's literally not. The leading causes of health issues include obesity and metabolic problems and crappy diet and crappy sleep and crappy exercise. Those three things have almost nothing to do with dating a narcissist, just so we're clear, because there aren't that many narcissists. Narcissistic personality organization, which is different than narcissistic personality disorder, are not the most common issues we see on the planet. So I don't know where she gets this from. It's patently absurd. So here's what I retweeted. I said, this is an absurd take. And I said this 4 days ago. Almost every health issue, no way. Narcissists are not causing you to get shitty sleep or eat terrible food or skip the gym or whatever. It's impossible. Megan said in the chat here, good Lord, everyone's ex is a narcissist on social media, which is just patently not true. It's statistically impossible for everyone's ex to be a narcissist. It's possible that people have narcissistic tendencies. It's possible that people, ran into one or saw one on TV and projected that onto their ex or whatever, but it's just statistically impossible for everyone who had a selfish ex to be a narcissist. Selfishness is not narcissism. And this is something that might be controversial to say. However, I think it's literally the truth, which is people are selfish for dozens of reasons. I've had patients with severe PTSD who are wildly selfish. I've had patients who are psychotic who are wildly selfish. I've had patients with severe substance use disorders that we call addiction who are wildly selfish. So selfishness is not characteristic of a particular illness or particular pathology. It's just the manifestation of a series of problems that could be related to a diagnosis or not at all. Maybe you just had crappy role models and you don't even have a diagnosis, and that's why you're selfish. Drew says, perhaps some motivated reasoning there. I would say probably, and I think probably if I were to do just a little bit of psychoanalyzing, which I cannot possibly know, obviously, but if I were to do just a scotch, just a soupçon of analyzing, I think a lot of professionals, people with degrees, are terrified of their own narcissistic tendencies. I'm going to say that again because I think it's worth reiterating. I think that many people in the helping professions, medicine, nursing, therapy, EMTs, and so on and so forth, I think a lot of people who do power-based jobs have narcissistic tendencies, traits that they don't really want to acknowledge. And I think that because they're not willing to acknowledge those things, they think they're bad, or they only have a bad stereotype in their head. And fair enough, there are plenty of really, really bad examples of people with narcissistic traits or even the disorder hurting people. So people don't want to be perceived as hurting people or even affiliated with a group of people that could hurt people. Excuse me. And so, like, my point is not, it's bad to distance yourself from narcissism or something like that. I just think it's a really facile understanding of what the issue is. So all personality traits, all personality styles. So traits are these individual little things that make up a style, and styles can be part of a disorder, right? So like Russian nesting dolls. So just because you have some narcissistic traits, maybe like less empathy or more grandiosity, doesn't mean you actually have a personality organization or a disorder. And so if you have some traits, that's totally fine. Maybe those traits are useful in certain contexts for you. Maybe they're not. In fact, basic personality theory is these traits exist for a reason in the general population because these traits allow us to develop niches and specialize in behaviors and relationships and skills and things like that to survive, because we need a diversity of types of people to survive. Diversity is a good thing. I don't know if that will creep some of you out, but it's true. Diversity of types of people is a good thing. I actually like having a world full of different types of personalities, people of different political beliefs, people who are kind of narcissistic, people who are kind of borderline, people kind of histrionic, kind of schizoid, schizotypal. All the different personality styles are actually probably useful in some way. Because if you think of human societies as ecosystems, you don't just have one type of mushroom in ecosystems. You don't have one type of bird or one type of cat or rat, or you have different types of creatures that serve different purposes. And so I would like to think, and maybe I'm wrong, maybe this is just wishful thinking, but I think all personality organization types, personality styles could be useful. So in that one particular perspective, I think Dr. LaPera is kind of like missing the point of what personality is in the first place, because there's actually a lot of utility to being narcissistically organized. Most therapists benefit from it because therapists love having power, or most of them do. And the therapists love helping, right? Which means they love being special enough and skilled enough to get special attention, special, deference from patients or whatever. Now, that's not how I think about it, but that's like a euphemism, a metaphor. So, but also there's tons of industries where narcissism is perfectly useful. Like a lot of good CEOs are pretty narcissistic. Many good performers, musicians, actors, all these different types of people, very narcissistic. And thank God they are. Thank God they love attention. Thank God they love being treated special, because they probably will go do cool shit that we love to watch or laugh at or listen to. So I think there's just a frank misunderstanding of what personality is and what the disorder specifically is, because when you write in such vague terms, because she wrote in very, very, very vague terms, right? Very, very vague terms. And so one thing that's very clear to me is if you're following mental health professionals of whatever degree, whatever background, training, online, on Instagram, Twitter, whatever it is, you should always be extremely wary when they say very vague things, right? When they say vague things like narcissists are the cause of all of your health problems, that's just bullshit. Because it's impossible to actually, you couldn't actually do enough peer-reviewed research to specifically hone it down to just this one variable. If you actually understand how science is done, to create a study that could control for all extraneous variables to focus on just narcissistic personality disorder or even traits of narcissism, like grandiosity or something, you would need such a wildly special sample and lots of samples over time to be able to find that finding, and she cited no such thing. So that's basically a scam. That whole post she wrote was a scam. It's scientifically bankrupt what she wrote. And anytime any of us, myself included, write such vagaries, you should be very, very, at minimum, skeptical. At minimum. But it's just bullshit. It's just absolute bullshit. So please don't worry about narcissists. They're out there and they do hurt people, but there are also plenty of narcissistically organized people who are minimally harmful or not harmful at all. But it's not the only personality organization that causes harm to self and other people, right? But also, beyond even that, it's not obvious that narcissism is inherently bad because it also has some upside as well. Drew says, it's not obvious that these traits are things to be fixed or addressed in therapy insofar as the person identifies them as a concern. For sure. For instance, a number of people that I have treated have narcissistic kind of organizations, and it is consequential in some of their relationships, but also you can find ways to turn that into something useful for those people as well. So tempering traits could be helpful, or finding different ways to express them in different settings, right? Could be helpful as well. Noman's here. He says, yo, here again from last week. I thought narcissists were bad people and being a narcissist was bad. You say it ain't? Absolutely. It's absurd, I think, because like it's one-dimensional thinking, right? It's like being tall. Right. So personality traits are akin to other physical traits like hair color and height and eye color and skin color and all these things. And there is no inherently good or bad skin color, hair color, eye color, or height. Right. So every height carries certain benefits and consequences. Being super tall, like above 6 foot, carries all sorts of benefit. Literally, because you can reach things and wingspan and all these things. But the taller you get, the harder your heart has to work. So being super tall is not usually great for your health because you're going to wear out your heart faster, or you could more easily wear out your heart faster, right? As an example, right? So no trait is inherently good or bad. All traits carry upside and downside. So trait narcissism carries upside and downside. Being histrionically organized carries upside and downside. Schizoid. Every type of organization carries an upside and a downside. And the question just becomes, do the various types of downsides currently outweigh the upsides? That's the real question. So a competent clinician who is scientifically minded will be curious about how this person is built, in what ways it's helping their life and hurting their life. And in some severe cases of narcissistic personality style and organization, it's more harmful than helpful. That does happen. It's a real thing. However, to make a blanket statement that all narcissism is narcissistic personality disorder is absurd, if that makes sense. And so there's traits, there's personality style, and there's personality disorder. Most people have a personality style of some kind, and it could be centered on the DSM categories or not. But that personality style may or may not be helpful across different circumstances. Now, the more severe versions of those traits, right? So if you score at the 90th percentile on trait grandiosity or something like that, then yeah, of course, you're going to have probably a more consequential life because the 90th percentile on any trait is going to be, maladaptive in some obvious ways, just like the 10th percentile would be. So it's really a question of percentile thinking, which I don't think she evidences at any point in her whole thread on narcissism. So that's just whatever it's worth, just for whatever it's worth. Okay. So yeah, Noman, narcissism is not inherently bad. It's a question of how narcissistic you are, how much it's impairing your relationships in your life and your health and all these things. It's more gray than it is black and white. And that's what the research tells us. If you don't believe me, go read the research by people like Keith Campbell, narcissism researcher, famous narcissism researcher. You know what I mean? Don't trust me. Read the actual primary source data that actually confirms or disconfirms whatever I'm saying. I just have tried to read these things and have an understanding of these things. What would I know? Anyways. So let's transition out of narcissism, which I know everyone loves talking about, and let's transition to, let's see, what would be a fun one to start off with? What would be a fun one here? All right, let's talk about our buddy, our friend and colleague, Nick Tabor. All right. Here's a really good post that I think is worth elaborating. So about a week ago, Nick Tabor, who is a critic of the profession in general, put this out about a week ago. Okay. So on 124, about a week ago, here's what he said. Nick said, and his handle, if you don't know, is at NICKTABEER. He said, and this is in response to somebody else, but it doesn't matter what the original tweet was for this particular discussion. He said, my point is that often, whenever or whatever is being deemed a behavior problem is a response to being mistreated, harmed, or abused in various ways. The kid might be powerless in a dynamic, and they're coping how they can. Then the adults step in and modify that response without addressing why the kid is suffering. That is incredibly cruel. So Nick and I have had a number of back and forths on Twitter for the last couple of months that I think are very productive and spirited. And this is one of those times when he and I will probably agree more than we disagree. So I think of it in shades of gray. Sometimes we disagree more than we agree. This is one of those times where I think he and I agree more than we disagree. So when it comes to adolescent and child behavior, there are many complications from the professional side of things that most people don't realize. So for those of you out there who have kids, or for those of you out there who work with kids, I want you to hear this very loud and clear, that your child or the children you work with are in a very complicated setting, so it's not 100% clear what really is a quote-unquote mental health problem. It's much, much more ambiguous for kids than it is for adults, because kids are forced to be in systems that they cannot consent to be in. So I'm going to say that phrase again. Children and adolescents are forced to be in systems that they cannot consent to be in. So for that reason alone, determining exactly what is happening with a child or adolescent is not super clear from a clinician's perspective. So just to pick two particular systems, okay, that children and adolescents do not consent to participate in. One is school and the second is family. And so both the school system and the family system are forced upon children and adolescents. They do not have the capacity to voluntarily opt out of either of those systems. It is a bit totalitarian, the way that families and school systems work. And I don't mean that jokingly. I mean that more literally, because you don't have a choice. Now, people will argue that family and schools are very good institutions. And I would say that that's a very facile view of how institutions work. I think family is very important. We all desperately, badly need family support. Now, that family can be different things, in my opinion. It can be primary biological parents. It can be non-biological parents. It can be best friends. It can be whatever constellation of people. But I genuinely believe family is extremely important. However, the voluntary nature of it is where things get muddy and messy for children and adolescents. Same thing with school. School can be very, very helpful because it can be structure, it can be forced socialization, it can be all sorts of things that are very useful for most people, although there are exceptions where it's not super useful. However, at least in the United States, the educational system is broken and bankrupt and mostly useless in the sense that it's not producing outcomes that anybody really wants anymore. And it really hasn't been, because it was created for factory workers, right? And we don't live in a factory worker society anymore. So it's really important, I think, for everybody to be super clear. Fucking goddamn it. Sorry, couldn't help myself. It's super important for everyone to be very clear that these forced systems do affect kids. Do you need a Kleenex? Do you need a Claritin? Anyways, so it's really important that we see the pressures that kids face are different than the pressures that adults face, right? So the two particular systemic pressures that kids and adults face differently are family and schools. So is it me saying that the only reason kids will have behavior problems is because of families and schools? No, I don't think that at all. I think there are plenty of kids who are really screwed up, and sometimes it has nothing to do with family and schools. For instance, some kids are very antisocial, and that's not because they were beaten. Some kids were like that from very, very young, for instance. There's a very, very small subtype of antisocial child, and it's like maybe less than 1%. It's very, very rare, statistically speaking. But those kids were always going to be that way. And it's not because society failed them or parents failed them. It's just sometimes people are built with such intense personality differences that you cannot socialize them in the way that you would like to. So the various types of tendencies that are not within our control to influence very intensely, we have to have those as exceptions. However, for the broad middle, 80%, 90% of people, most people are shaped to some significant degree by the environment they're brought up in and the school that they're forced to attend. And so I agree with Nick that a lot of problem behavior in children is systemic in nature. And what I mean by that is, for those of you who are not, in the industry, what I mean is there are so many forces outside of the individual that modifying those forces outside of them would be more helpful than just doing individual therapy with the kid. Excuse me. And so, for instance, it's often the case that children, not adolescents, have all sorts of anxiety issues. Anxiety is the most common disorder in kids. But the problem with that stat is that we don't know to what degree that anxiety has more to do with the environment than it has to do with the individual. The idea that anxiety disorders are the most frequent disorders, most common disorders in kids because kids are broken or something is absurd. Most kids in development, across early development through puberty, will experience all sorts of challenges and be just fine, even though it feels subjectively very bad at the time, right? And so I think a lot of bad research is being done, honestly, that's conflating situational anxiety with an actual disorder. Because most of the research is not really looking at the family and how screwed up the family is. And most of these studies are not looking at the type of environment the kid is in, right? So there's all sorts of neurodivergences nowadays, ADHD, autism, so on and so forth, that are becoming, I think, more popular, I guess. And, some kids are not meant to sit still. In fact, what I would argue is that it's really fucking absurd that children are asked to sit all day. That's absurd. It's so absurd how much we are asking people to sit all day as kids. Kids are supposed to be doing things. And so would that contribute to the fact that kids are more anxious because they're forced to sit all day? Probably. I think that's a real important systemic variable that no one talks about. I don't think kids are more anxious than ever in history. I think they're just forced to be in really stupid systems that are not built and designed to actually help them thrive, right? So I agree with Nick that a lot of behavior problems in kids are systemic. So for instance, oppositional defiant disorder. This might get me canceled, I don't know. But 9 times out of 10, maybe 9.9999999 times out of 10, ODD, oppositional defiant disorder, is a parenting disorder. It doesn't matter if it's a single parent, multiple parents, grandparent, whoever. But if your primary caregivers have crappy boundaries with you, you're going to present with ODD. Now, it's not like it's that simple. I said a very simple phrase, which is ODD is a bad parenting disorder. I didn't describe why the disorder develops, for instance, right? I didn't say that. But what's going to maintain ODD is if parents have inconsistent boundaries or unclear boundaries. Once parents develop consistent and reasonable and clear boundaries and hold them, ODD just disappears in a couple of weeks. Now, the problem is some parents are exhausted, so they can't hold them. They can't hold their boundaries, right? So I'm using ODD as the example of like a systemic problem. In fact, every person I know who's professionally worked with children and adolescents think it's all a systemic problem. So like parent-child interaction therapy, PCIT, one of the most efficacious evidence-based therapies for little kids with mood issues or whatever it is, literally it's about parent coaching and teaching parents to respond more effectively to their kids. So you treat most childhood disorders by fixing the system, not trying to fix the kid. Megan has something to say, and I think it's worth reading. Here's what she said. Adlerian, like Alfred Adler. Childhood anxiety is normal. They feel inferior due to small stature from adults and immaturity and less ability to control the environment. Spot on with ODD. Yeah, I think Alfred Adler was like generally correct. It's like a broad strokes approach to things. I think kids feel disempowered for dozens of reasons, whether it's intelligence or size or stature, motor skills, or just agency. Like you're in a family, you're 5, you don't have money, you don't have a big body, you can't get away with things like your adults can. So like you're limited in a dozen ways. So you are disempowered compared to the adults. So good adults, good parents will try to help you learn how to feel more empowered over time as you develop more skills and more agency and you get bigger and you develop more verbal skills, whatever it is, right? So like good parents are rare. Good therapists are rare. Here's what Jonathan said. I've never met someone with ODD who didn't have an ADHD diagnosis or very similar presentation. In my opinion, that diagnosis, more than some others, distracts totally from the underlying problem. Great topic. Absolutely. There's so many kids with behavior problems in school that are just different. They're literally different. ODD is almost always like ADHD or autism or not being super smart or not being super skilled at managing your emotions or just having crappy boundaries at home, right? One of the most toxic things a parent can do for a kid is be inconsistent. So just becoming even marginally more reliable is great for kids' mental health. Dr. Dan Siegel, for those who don't know, Dr. Dan the man, Dr. Dan Siegel talks about this acronym FACES. Flexible, adaptive, coherent, energized, and stable. So flexible is a variant of reliable, which means that you have some consistency, but you bend as needed. But you start with consistency. Flexible adaptive, which means you do adaptive things. You do what works, not what doesn't work. Coherent, which means your behavior should make sense in context, right? You shouldn't yell and scream when there's no reason to yell and scream. And even when there's a reason to yell and scream, especially as a parent, you might want to think, how useful is it, how adaptive is it to actually yell and scream in this context, right? Yelling at your little kid, not usually very useful. So yeah, Jonathan, I agree. I think very few people diagnosed with ODD, that was not the actual issue. I can't imagine it ever being the case that ODD is a primary diagnosis of anything. It's almost always a secondary diagnosis or not even an accurate diagnosis. It's just where there's smoke, there's fire, and it's the smoke. The fire is the crappy boundaries at home or the misunderstanding of your kid, right? So if your kid is kind of ADHD, if they have serious hyperactivity or serious inattention issues, then like what environment do they actually need? Right? And obviously we're all limited in how we can provide a perfect environment. No family is ever expected to be perfect. No parent is ever expected to be perfect. And anyone who tells you that there's this secret magical formula to being the best possible parent is full of shit, because life is hard. It's hard to be a parent. Parenting is one of the hardest things people do, and it's one of the most important things that people do. And so the idea that any of us can sit here and say, here is the secret way to be a parent that will make everything perfect is full of shit. But being basically reliable, reasonably flexible, and trying to choose the adaptive, stable choice is generally going to be more helpful for kids than harmful, right? So being basically reliable, basically reasonable, and handling your feelings as a parent will be the most important thing you can do for your kids, 9 times out of 10. But those 3 things I just described are wildly complicated and situation specific. So I'm not trying to overgeneralize or create simple, impossible standards. I'm just saying, like, generally speaking, as Drew just said in the comments, just good enough. You know, can you 60% of the time keep your shit together? Can you 60% of the time keep your emotions in check? Can you 60% of the time be reliable and responsible at least? Just good enough. Just like do your best, you know? The other thing I see all the time is parents who think they know things when they don't know a thing. So I hope that all parents feel free. This is just me. This is years of working in drug rehabs with adolescents and young adults. I hope that every parent has full permission to not understand their kid. And the reason I say that is because it's almost literally impossible to accurately and fully understand your kid. That's like perfectionism that's absurd, if that makes sense. So what I would say is, parents, you have permission to not fully understand your kid because you never will. But also, you can do more to try to understand people, but try to not impose reality on your kids because you don't know them. Noman says, being a dad is hard. Baby mama ain't on the same page when raising my daughter. Yeah, being on the same page is hard. You know, whether you're married or dating or divorced or whatever, being on the same page is very, very hard. One of my good friends and colleagues is a step parent, and I would only imagine, an excellent step parent. However, we had a conversation the other day, and it was like 100% clear that she felt so disempowered, not only because she's a step parent, but like, it's hard to be on the same page when you don't know if you have the same authority as the other person, for instance. So having grace for the other person is extremely important. If I were to make a blanket recommendation, which is usually silly to do, so take it with a grain of salt, I think grace is extremely important for parents. You know, so if you have an ex that you're co-parenting with, or you're married, or you're dating, or whatever it is, I hope you have lots of grace for your spouse or your significant other, because they don't get you. We don't get each other. We're trying to understand each other. Trying. The best we can do is try to understand each other. It's absurd to think you understand each other. Megan says, the curse of therapist mom, overanalyzing and reading into too much behaviorally. Yeah. If you have parents who are therapists, my condolences. It is horrific. I grew up with a therapist parent. It's the worst. You know what I mean? So yeah. And if you are a therapist parent, just pray that your kids come out wanting to do anything but being a therapist. You know what I mean? It's one of my inside jokes with my good friend, Dr. Scale. So yes, Nick, you and I agree that behavioral problems with kids are often about systems. And the second part of his tweet is, then adults step in and modify that child's response without addressing the real reason they're suffering. Yes, so it's our job. It is our job to look at the whole system, adults or children. But we definitely need to look at the system. Drew says, my poor future kids. Yes, pray that your kids, Drew, become a lawyer, maybe a doctor. Doctors, you know, it's like, it's borderline maladaptive. Lawyer, race car driver, fitness instructor, just anything that's like not helping professions would be good, you know? Anyways, so all kidding aside, it's really important to think twice about kids and why they're quote unquote acting out. Which, by the way, I know there's this landmark legal case that just happened, and I'm just going to say a few words about this, even though I wasn't intending to today, but we're on the topic, right? So there's this case that just broke today or yesterday about this person who calls themselves a detransitioner, and their name is Fox Varian. So I don't know the specifics of the case. I know what's being tweeted about the case, but I don't know the specifics of the case, so I'm not going to try and address anything specific. So the gist of the case is this person named Fox, F-O-X, just won a $2 million settlement about Detransitioning, they sued their psychologist and their doctor who did the surgery for their childhood transition. So there's a couple of things I'd like to say about this because I think it's unfortunately a topic that a lot of people are going to discuss with little grace or understanding or nuance. So I'd like to try to role model what it means to be a reasonable professional I've worked with these people professionally. So I have relationships with folks in the community and I've worked with these folks professionally. And so here's what I will say. If this person believes they were genuinely harmed and misled and informed consent did not happen, then I understand the basis of their lawsuit from a legal and ethical perspective. And I have nothing to say about that other than I understand. If that's what happened, then I understand why they made that lawsuit. That's all I'll say about that. If it is the case, right, that people who are adolescents, who are very confused, hurting, lost, suffering, self-hating, whatever it is, and they believe they have gender dysphoria. Now, that phrase is kind of tricky, so just bear with me. So if adolescents or younger folks are suffering and they have this incongruence in their mind, between their mind and their body. I don't know how big the incongruence is because it's different for different people. Some of the people I've talked to, some of the people I've worked with professionally have always had an intense dislike and hatred for their genitals. I don't know why. We have no clue why. Anyone who pretends to know why is lying. None of us know. We don't have good data. We don't have good research on this. This is new stuff that we don't have good data on. And we have a lot of case studies. Case studies are important, but case studies aren't reliable. Case studies are subjective, right? So young people that have intense gender invariance, incongruence, whatever word you like, whatever makes you feel good, I don't know. Those people are especially vulnerable. Just like young people with severe depression or young people with, let's say, behavior problems. And so my belief is when people who are young, when they're adolescents or children, are very confused and very emotionally dysregulated, it's our ethical duty to do what we can to help them feel understood, right? That's what good clinicians do. Our clinical training, our ethics code says, first do no harm, beneficence, non-maleficence. We want people to be whoever they are and help them feel understood. And that seems reasonable. And so one of the problems that I have with surgeries and hormones for younger people specifically is I don't know that those interventions actually help people feel understood. Those things usually help people feel in alignment with what they wish to be true or they believe is true, but not necessarily what is true, right? And that's the problem with everything mental health, is every mental health diagnosis, whether it's gender dysphoria, major depressive disorder, personality differences, doesn't matter, are all aberrations of ordinary functioning or more, 50th percentile functioning, if that logic makes sense to you. So it's absurd for any of us to think we know what's true. Like, I don't know how kids are supposed to feel about their bodies. I can't know that because I don't live in those people's bodies. I know what it was like for me as a dude in adolescence. I know what my experience was like, but the idea that my experience is going to be like everyone else's is absurd because I'm different in various ways. And so what I think everyone needs to consider here is many of these kids who say they're trans or, have been diagnosed with gender dysphoria are very lost and very confused. And so I think we should all shut the fuck up about these cases because there's so much complexity and it's so subjective that none of us know what the conversations were actually like with the psychologist in this case or the doctor in this case. None of us know how sick the parents are. None of us know how much the parents were actually involved or not. None of us actually know any of these things. And kids' mental health, as I was just saying about Nick Tabor's post, is extremely complicated. So when you really respect someone, You don't comment on these things like a culture warrior. When you respect someone, you leave them the hell alone and you allow them to figure it out. And so my encouragement to everyone about kids and gender dysphoria and things like that is shut up. Just shut up and let them have their experience. And let's pray that everyone who's trying to help them is ethical and understands what we know and what we don't know. And that's it. And it's really that simple, because I don't know. I've worked with so many people in the trans community, and sometimes it makes perfect sense to me, and sometimes it doesn't. But even the times when it doesn't, how am I going to judge that? I don't live in their body. I don't know what it's like to be in their mind. Just like if you've never been psychotic, and I'm not comparing gender dysphoria to psychosis, don't cancel me or cancel me, whatever the fuck you want. I don't care at this point. But like, you don't know what it's like to have an auditory hallucination until you actually have it. You don't know how distressing it is. You don't know how crazy you feel. You don't know how worried you are until you actually have that experience. We can intellectualize about it, but until that happens to you, you don't know what it's like. So my encouragement to everybody is just to not talk about this topic and let people live in peace and figure themselves out. I don't think any clinician talking about this is making the world better, personally. Whatever side you're on, I don't care what side you're on. You think you're advocating for something because you believe you have a moral or political obligation or whatever it is, and that's about you. And maybe this isn't about you and what you want, because the world is more complicated than you, you know? So all I will say is it's complicated. And in the spirit of treating people with respect, I don't know what this was like, so I can't comment on it, you know? All I can do is say, this happened, this is what was reported, this is what the person said happened, and how does this inform how we approach this in the future? That's all we can do ethically and legally, right? So for me, I think everyone should shut up about this and stop letting these kids be a political football. And I think that if you don't know what you're doing, if you don't do informed consent correctly, you probably should be sued. But like, if that's the standard, then a lot of therapists could easily get sued, because very few therapists actually do informed consent correctly, to be fair. And psychiatrists probably even less so, because very few people actually tell the truth about what we know and what we don't know, and what we think will help and what will not help, right? So just for what it's worth, I don't care about the Fox variant case, because I wasn't the treating clinician, and I don't know this person, and it's not my place to comment on what I think happened. It's all fantasizing. And the people that do, I think, are doing it to score points politically or make a moral argument or protect people. And like, I don't think any of us can protect other people. I think I can barely protect my own patients, because life is difficult. You know, it's my job to not harm my patients. That's the end of my scope of practice. You know, not to whine about it on Twitter or protect people on Twitter. So that's just me. One more quick one. So Nick Tabor again. Okay. So Nick is really good at saying, in broad strokes, straw man kind of way, these incendiary things that I feel it's worth it just publicly to respond to them, because I think in the spirit of discourse, he and I talking to each other and actually having a conversation as opposed to just, you know, being nasty to each other, it's good that we talk it out, right? So here's what Nick said a few hours ago. He said, mental health professionals, it appears, it's a good caveat. He said, mental health professionals, it appears, are socialized to not, NOT, account for how the clinical paradigm in mental health itself often breaks people. So as I responded to him, that's incorrect, because in graduate psychology training, especially like doctoral level, the American Psychological Association, if you have an accredited program, dictates that you actually talk about the ways in which we harm people, right? It is our ethical duty to know all of the ways in which we could potentially harm somebody. So Quality graduate psychology training talks about the limits of what we can and cannot do in terms of what's both efficacious and harmful. And all clinical interventions harm people, just like all medical interventions harm people. And so it's very important to be clear that harm is part of the process of healing. So the question becomes, how much harm is acceptable? And that's a subjective case-by-case conversation. If you're seeking out therapy, dear consumers of therapy, psychiatry, counseling, coaching, whatever it is, marriage counseling, whatever, you should expect to feel bad and quote unquote be harmed at some point or points along the way. That is normal. Now, you're going to be harmed by yourself, you're going to be harmed by reality, you're going to be harmed by the relationship with your clinician. All three things: self, reality, and the relationship with the clinician. That being said, life is not about having zero ruptures. Mental health healing is not about zero ruptures. Healing is about rupture plus repair, right? So when you do feel like your therapist has said something that bothers you, hurts you, confuses you, offends you, it is your job to say something and then repair it, right? And the therapist's job is to help repair and do their part, right? As equals. So harm is ubiquitous. It is part of life. And so harm is something we should all expect. And the question becomes, how much is acceptable? What risk is acceptable? And when you're doing your informed consent conversation, see earlier point, you're supposed to explicitly state how much harm you think is possible, what could help and not help, and why. Same thing with harm. Drew says, many of Nick's arguments just aren't limited to psychology or psychotherapy. Imagine what kinds of harms are caused by poor educators. And Nick talks about how bad teachers are too. You can make the case that a bad K-12 education sets you up worse. Absolutely. Therapy, medicine, school, parents, religion, everything can hurt you and screw you up permanently to some degree. So the question is, should we just abandon all this stuff and just say, screw it, it's all gone? I don't think so. I think what we should do is we should try to reform these institutions. That's explicitly my podcast. This whole podcast is about openly criticizing things and trying to reform systems by just shouting into a microphone basically every week. Not shouting. Am I shouting? It's like that clue thing. I'm not shouting. Anyways. By the way, rest in peace, Catherine O'Hara. Very, very sad. Amazing actress, just gone. Brilliant person. Yeah. So, yeah. Nick, you're silly. I like you, but I think you're silly. And I think that you're on the right path by saying that mental health clinicians should be more concerned about harm, because many of us do harm, myself included, without being aware of it. So it's our job to catch it, make it better, and not do it again, right? So here are some ways that everyone can be harmed less by therapy. Number one, get better training, hire better professors. Number two, be more accountable. So you could do things like, once you get licensed, continue with a supervisor or a consulting clinician. Be part of a consultation group. Have good friends that are in the profession that can hold you accountable. I'm immensely lucky and absurdly lucky that I have a bunch of people, including some of the people commenting on this chat, who can help me stay accountable. Because I know if I screw up, I'm going to hear about it from them. If I'm not on my A game, if I'm not paying attention, if I'm not attending to countertransference, my bias, my differences, I can hurt people. So I'm the luckiest man in the world that I have colleagues who help me stay accountable. And so it's really important that we both have better education and training, but ongoing accountability, not just continuing education credits, but ongoing consultation. And one thing we could do to reform the system is make mandatory consultation groups as your condition of licensure, as opposed to CEs, because CEs are mostly crap and they're mostly outdated, but they're interesting. Some of them. Sometimes CEs help people be better at the job, but not usually. You know what I mean? So anyways, Nick, keep going. We'll keep talking. We'll keep the dialogue running. So I think that's it for today. So there have been a number of you that have come out to watch, a number of you that have come out to chat, and I am extremely grateful for you being here, because the more you're here, the more interactive it is. I think the better it is for everybody. So thank you for being here. Thank you everyone for commenting, chatting, sharing, agreeing, disagreeing. Really glad you're here. Thank you all for being here. This has been episode 53 of UnShrink Me. We're done. I think we did it. I think we did it. I think it's over. And so I will see you all next Saturday at the same bad time, the same bad channel. And if you are not already following me on Twitter, come follow me on Twitter at Alobha Patrick, ALOBHA PATRICK. And please like, share, and subscribe to this podcast on YouTube. I would really appreciate it. And spread the word. Help me get these ideas out, because I want to hear more people push back on me, like Nick and other people. And I want to make sure people are aware of, what's ethical and what's not ethical, and what helps and what doesn't help. That's the spirit of this podcast, is help everyone get more out of their clinical services and not be misled by charlatans. So thank you all for being here. Thank you for showing up. And as always, I like to end this on a joke. I don't know if ending on a joke is good for you, but it's certainly, I think, good for me. And so I once had this patient. This patient had a really bad case of PTSD. Really nice guy. And he was a professional who worked in like stunts. He was like a stunt guy. This is Hollywood. A lot of stunt guys out here. Anyways, so he was a stunt guy, basically. And he was in a really bad accident one time doing a stunt, believe it or not, while riding a horse. He fell off a horse. Now, he didn't break his back, but he did get really badly hurt. And so basically he had PTSD from falling off the horse, because it kind of like ruined his career, basically. And so he'd been out of a job for a couple of years and having some PTSD symptoms and really struggling. So we saw each other professionally, and he, he told me about what his life was like and all this stuff. And it was good. And we started talking about his PTSD symptoms. He had some nightmares about falling off the horse and his job and all these things. And so we did some standard, exposure around it, and it was helpful. And one of our goals ultimately was to start getting back out there and dealing with horses again. So, we created an exposure hierarchy, and, we do things like watch movies and sit with the distress and, movies around horses and all this stuff. And, near the end of therapy, he was actually able to go out to a ranch and start interacting with them again. And then before our last session, apparently, he was actually able to get on top of one and start riding again. And I kind of asked him, like, how was it? What was it like? How bad was your anxiety? Did you have any panic? What was it like? And he said, it was great. I felt free again. And, I said, sometimes you just have to get back on the horse, right? All right. It's good to see you all. See you next week. Take good care of yourselves. Take good care of other people. Have good food. Have good sex. Get good sleep. Pet a cat sometimes. Do good stuff to yourself and other people. Don't be bad. I don't know what that means. I'll see you next week.